Good afternoon. Thanks so much for tuning in to 12 News at Noon. I'm Tracy Koenig, and things are starting to heat up, unfortunately, in the tropics with Tropical Depression 13 and 14. And right now, Southeast Texas is in that cone of uncertainty of TD 14. Let's get an update right now on the tropics and see how concerned we need to be, Jeff. You know this makes my heart start pounding whenever I see this.
I know, and you're not alone. There's lots of folks here in Southeast Texas feel the same way.
Yeah.
And right now we have three different things we're looking at across the area. One is just now coming off the coast of Africa. Not too concerned about that. We'll worry about that later. And then we have our two tropical depressions. One is 13, which looks like it's going to be headed towards the eastern sections of the Gulf of Mexico. What we're really focused on now is Tropical Depression 14, which just formed for this morning. Let's take a look at the latest track on it. Right now, winds are at 35. It's moving to the west at about 21 miles per hour. It's out in the Caribbean. Looks like it's going to make a real close scrape close to the Central America, and then as we head into Sunday, it's going to come over the Yucatan. Actually, they're expecting it to strengthen before it gets to the Yucatan, and then weaken just a little bit as it goes over land. Then it moves out into the central Gulf of Mexico. By Monday morning, winds are at 60 miles per hour. After that, it moves up towards the north and west, and by Tuesday morning, winds are at 60 miles an hour, and they have it moving up towards possibly coming in towards Southeast Texas, Houston, somewhere in that area. Right now, I don't want you to focus, though, on the center of this track. Focus on this whole cone of uncertainty. It goes from Brownsville or Padre Island all the way over towards almost New Orleans. So there's a lot of room here for this thing to switch from east to west or to move from one way to the other. So don't focus right now on the center of the track and think there's a hurricane that's going to make landfall on Tuesday. There's a good chance that we could see a tropical system on our doorstep next Tuesday. But once again, there's a lot of room for changes here as we go through the next several days. We're going to keep tracking it for you. We're going to have more on this system. We're going to show you what's going on with Tropical Depression 13 as well coming up in weather.
New this afternoon, Port Arthur now reporting its 25th COVID-related death. This comes after we saw 7 new COVID-19 deaths in our area on Wednesday and more than 300 statewide. As far as daily cases, it was kind of a mixed bag. Across the state, a slight dip in new cases, but right here in Southeast Texas, we saw a slight uptick in cases. And to give you some perspective, if Texas were a country, we would be 6th in the world for the number of cases, 15th for fatalities linked to the virus. And if you were to compare our cases globally right now, we are just behind other heavily populated countries like India, Brazil, and Russia. Well, part of the mystery of the coronavirus is that a lot of patients never actually develop symptoms, and asymptomatic spread may be a big reason for the transmission in our area. Health experts say those who are pre-symptomatic and haven't yet developed symptoms could be responsible for 50% of COVID-19 transmissions.
We talk to so many people who actually state, I just went to get tested just because I wanted to get tested, and they find out they're positive. We're still seeing quite a bit of positive cases who are asymptomatic, maybe 1 in 5.
And that's why health experts continue to advise everyone to take precautions like social distancing and wearing your masks. Well, we told you about the backlog of COVID testing cases earlier this week, and now for the first time, the Department of State Health Services is talking about the issue on camera. William Joy has more on what's causing the backlog at the state level.
The Texas Department of State Health Services says it discovered its reporting backlog affected more than 500,000 tests.
When we see there are adjustments that need to be made, we're doing that as quickly as possible. We're doing it as transparently as possible.
For the first time, DSHS officials answered questions about the issue on camera. Data glitches and bulk dumps created issues with Quest Labs, Christus Meditech, and Walgreens.
So we can't guarantee there's not going to be some issue in the future, but what we can guarantee is that when we identify it, we'll work with that lab, we'll get it corrected.
People who tested positive were informed, but the state doesn't know how many positives are new to counties because health departments don't just use the state for results. It could be days before they're done checking.
I think this just highlights that there is definitely a need to update these systems.
Dr. Diana Cervantes is an epidemiologist with UNT HSC and says the backlog created bigger issues than just incorrect dashboards.
Those cases have slipped through the cracks, meaning that there wasn't timely contact tracing.
But she says people shouldn't doubt state data, including Collin County commissioners who put a disclaimer on their dashboards saying they have no confidence in the numbers.
But I think the way it was worded is it seemed more political to me.
Hospitalizations are falling but high. Deaths are near record levels and steady. Cases are declining, but so is testing.
COVID is still an issue in Texas. And that's what this data shows us.
If you doubt the changing numbers, trust the constant advice. Distance, wash hands, and wear a mask. In Fort Worth, I'm William Joy.
Evadale ISD students are back on campus today. All 3 schools in the district have been closed since Tuesday as the campuses were getting a deep cleaning after a student there tested positive for the coronavirus. We spoke with a Beaumont doctor about some of the risks attached to common school-related activities. Beaumont internal medicine doctor Mesonthi Levine, I should say, tells 12 News riding the school bus could put students at high risk of catching COVID-19 given the close proximity of the other students. He suggests walking if they can or riding in personal vehicles as a safer alternative. When it comes to lunch, Dr. Levine believes eating outside is a lower risk behavior than eating in the cafeteria. He admits this is all very challenging for our school districts.
Going back to school and having face-to-face, obviously there's going to be some slight spike in the cases. These are difficult times. These are tough decisions. I think every school district has done a good job bringing all of the important people together to make the appropriate decision.
Of course, there are risks associated with just about every common school activity. Dr. Levine says the best practice is simply to try to always follow the CDC's guidelines. Well, as the school year gets into full swing, parents are trying to assess the risks involved in sending their children back to class. But while some families have the option of keeping their kids at home or sending them back, other families don't have that same choice.
Meet Rita. She's a 6th grader who lives at home with her mom and dad. Meet her classmate James, who also lives at home with his parents. Rita's dad has a job that lets him work from home, and her mom chooses to stay home as well. They're in the minority because the Bureau of Labor Statistics says in 64% of families with kids, both parents work. Now, James's dad is an essential worker. He takes the overnight shift at a local grocery store and sleeps during the day. His mom also has a job which helps them pay rent and afford health care. These past few months have affected Rita and James very differently. When their school went online in March, Rita was ready. She got an iPad for Christmas and video chats all the time with her friends. Her family's high-speed internet makes it a breeze. According to a Microsoft study, James and his family are like more than 160 million other Americans who do not have access to broadband. Their computer is pretty old, and they use dial-up to get online. Video conferencing with his classmates hardly ever worked. Downloading a video? Well, that took forever. Over the summer, Rita's mom read all the research on just how important it is for kids Rita's age to spend time with friends, so she organized plenty of socially distant playdates. James has not been able to see his friends in months. His family lives in an apartment where there's not a lot of room to socially distance, and the nearest park is several miles away, too far for him and his buddies to walk. This fall, James and Rita's school is letting families choose between in-person classes or virtual learning. Rita's parents are worried about her getting sick, so they're going to keep her at home. James's parents are worried too, but with their jobs and no childcare, keeping him at home is not really an option. Rita's parents don't want her to fall behind, so they're going to hire a private tutor. James's parents would love a tutor, but could never afford one. They do want to help James with his homework, but with their work schedules, there's hardly any time. Rita and her family are excited about the upcoming school year and plan to make the most of the situation. James is worried about the fall, and he and his family aren't sure how they're going to make it work.